Good morning, everyone. A warm welcome for our audience. So today is our fourth webinar session on the web series on Naturopathy Day Awareness Week. So today we'll be inviting our speaker, Dr. Sabeetha ma'am, our expert in traditional Chinese medicine, who will be discussing the topic of acupuncture and its application in treating non-communicable disease. Ma'am has a wide set of skills with a span of more than 17 years as a clinician and an academician, and practicing in more than many hospitals and wellness centers. And today, ma'am will be enlightening us with the application of acupuncture in our current generation.
Okay.
I welcome you, ma'am. Over to you, ma'am.
Thank you, Dr. Suresh, for the warm welcome. So greetings from JSS INYS. So I'll move on to the topic. So the main topic of today is the naturopathy treatment, which is an acupuncture. This is one of the naturopathy treatments. So this naturopathy treatment is, we use only the Pancha Mahabhutas. We'll say it as a Pancha Bhudangal in Tamil. So we use this Pancha Mahabhutas as a base of our treatment. So based on this Pancha Mahabhutas, our treatment modalities will be differing. Okay, so I'll take a few minutes to explain what is the Panchamahabhutas and what are the treatments based on Panchamahabhutas in naturopathy. Then I'll move on to the acupuncture topic. So the first Mahabhuta is in Panchamahabhuta, the first thing is the Prithvi, Ap, Tejo, Vayu, Akash. These are the five Mahabhutas, and the Prithvi means earth, water, fire, air, and space. So these five elements, we use it as a mode of treatment. Earth, in the sense, we use some solid materials to give a treatments. Water we use in hydrotherapy, and then fire, the quality of heat has been used in treatment. Air we use in treatments as a naturopathy treatment, and then space is also has a vital role in the naturopathy treatment. So these are the basic naturopathy treatment. First and foremost will be the the hydrotherapy. We use water as a medium of therapy or a treatment. We'll say there are many treatments in hydrotherapy, which is, for example, I would say baths. Hip bath is there, spinal bath is there, and then immersion bath, and then steam bath. All those things we use water as a treatment. And then we use certain packs, abdomen pack, liver packs, leg pack, knee pack, and all those things are there. So we use water as a medium. This water's temperature has the vital role in giving the result, you can say, in treating the deceased persons. So next is the diet therapy, where the deficiency or the nutrient supply will be given according to the disease conditions. And also the very important thing or the very interesting thing in naturopathy is the diet, where we have the eliminating diets, soothing diet, and the construction diet. The construction diet is something which has a lot of proteins in it. Elimination diet and soothing diet. Soothing diet is something which is like a soothing to your system, which means the GIT, we'll say. So a very interesting type of treatment is the diet therapy in naturopathy. And then we have a magnetotherapy, we have a color therapies. We use different colors for giving treatment in different ailments. Each color has a unique quality of healing, like, antiseptic is there, soothing is there, calming is there, stimulating effect is there on seeing the colors, on taking the colors. For example, is the plantain leaf bath. We use, the heliotherapy, the sun as a major healing mechanism in the, the treatments, naturopathy treatments. And next is the yoga therapy. As you know, we have a lot of researches done in the yoga, which says that yoga can soothe or can give nice results in the suffering patients, you can say, especially the what do you say, the skeletal-muscular system disorders and the internal organ disorders, what do you say, the GIT disorders, or many things. This yoga helps a lot. Yoga in the sense, not only the physical asanas, it has the next level of your, like, the pranayam meditations are there, different techniques of relaxations are there. So all those things has a major role in the what do you say, the to bring back the person from the disease to the normal, what do you say, the regular lifestyle kind of things. And the next is the acupuncture, which I'm going to discuss today in a little elaborate way, how the practice of acupuncture, and just giving an idea about what is acupuncture and how it is effective in treating the disorders. So acupuncture, this is also acupuncture as such alone. It follows the five elements theory. Here also there are five elements like fire, earth, metal, water, and wood. These are the five elements. Depending upon these five elements, the treatments on the disease, the imbalance will be happening. Okay. So in acupuncture, we'll say it as a chi, which means the vital energy. Vital energy is nothing but energy which gives the healing effect, or you can say which maintains your health, which harmonizes the individual's well-being. So that is called as chi. So this chi, it flows in a channeled way, that is called as jing. Okay, so this is also called as meridian. There are a lot of meridians are there, a lot of channels are there in acupuncture. So the flow will be in a particular pathways. Okay, that is called as jing or a channel. And then these channels, they have specific points, which means the acupuncture points, which are highly sensitive points. So that points has to be stimulated for the betterment or any imbalance. So those points will be selected, and those points are called as acupuncture points. So this acupuncture, it depends, or it works on the basis of Taoism. You might have seen this picture in a lot of times. So this picture says that there is something called as yin and yang. The yin and yang. One is positive and the yang is negative. This yin and yang has an opposite qualities, which means like one is high means one is low, one is negative, another is positive. One is yin is female, yin is female, yeah, and the yang is male. Yin is cold, yang is hot. But even though they prefer opposite qualities, they are interconnected, they are interdependent. One cannot function without the other. That is why in the image you can see the first image, the blue image has a slight dots of red, which has like blue has mild red, which says that blue is an yin, and that yin has little bit of yang in it, and the red is the yang, which has a small blue in it, which says that yang has little bit of yin in it. So only with this figure or with these qualities, the major health can be maintained. So any imbalance in this yin or yang, the chi levels, which may induce disease. So there are acupuncture points, I said, and that points has to be stimulated by these needles. Okay, so there are different types of needles in the acupuncture. So first commonmost needle is the filiform needle. Next is the triangular needle, press needle, and 7-star needle. This needle has a different what do you say, the measurements or the length. You can say half chun, 1 chun, 1.5 chun, 3 chun, 5 chun, something like that. Different length of the needle is there. So the commonest is the filiform one, and this is the filiform needles diagram, which has a handle, it has a root, body, and the tip. So in this, no, we have to touch the, or we have to hold the, or grasp the handle, and then give a forceful penetration via the tip. Okay, so the tip is ultra sharp, where the pain level is very less. I'll show in the next one. So this is an image which shows the how small a size is the acupuncture needle. The first is the matchstick, which is like around 4.2 mm, which is like around half a centimeter. And then second image is the hypodermic needle, the injection needle, which is 1.5 mm. And then next is the sewing needle, which is called as this stitching needle, we'll say, no, that is 1 mm. And that filiform needle, the last one is there's just quarter of the sewing needle, which is like 0.2 mm in the diameter, which is ultra thin. So that is why it is said that acupuncture, while doing acupuncture, the pain is less. Usually, most of the patients will not feel the pain at all. Okay. So the main reason is that because of the ultra thin and a full sharpness in the needle. Next. So we have a pulse diagnosis in acupuncture. So naturopathy also has a pulse diagnosis. So in naturopathy pulse diagnosis, something which is very unique, where we see 6 pulses in the right arm and 6 pulses in the left arm. So totally we can feel or we can give a conclusion of a 12 organs in our body. The chi flow or the vital flow of energy to a 12 organs can be measured in the hand pulse itself. So we have a first pulse, second pulse, third pulse, superficial pulse, and a deep pulses, and all those things. So we have a unique way of diagnosing a disease through the pulse diagnosis in acupuncture. Acupuncture, we follow something called as an organ clock. It's a theory actually. It's an organ clock theory which is like a more or less similar to the biological clock or the circadian rhythm, you'll say, scientifically. This is not the same as a biological clock, but it is similar to the biological clock. Here, acupuncture or the traditional Chinese medicine, what it says is like every organs or the 12 organs which is present in a form of meridian in acupuncture. So those 12 organs, like, heart, small intestine, pericardium, and all these organs has a specific time, which means like the heart has a specific, in a particular time, the heart energy, the vital chi to the heart will be high. So the heart time is morning 11 o'clock, something like this. The liver time or the wood time is like around, what do you say, the midnight 1 to 3 o'clock. The liver function is like that. That is the time where the body detoxifies. The liver detoxification happens in the night 1 to 3 o'clock. Something like that. We will be having an organ clock for a 24 hours. So while needling during those time has a, what do you say, the better results. That's what the result says. So that's about the organ clock. And how to stimulate the points. There is an acupuncture point is there, specific time. We said what are the special timings is there in organ clock, and how to stimulate the acupuncture points. So first and foremost is the point can be stimulated by using the needle, acupuncture needle. Second is moxibustion, where the heat is applied. Third is the cupping therapy. So all those 3 techniques can be used which can be used for stimulating the acupuncture points. This is the traditional methods of stimulation. There are modern methods of stimulating the acupuncture points, like, ultrasound, laser, and embedding needles, and all those things are the modern ways of stimulating. But these are the classical way of stimulating the acupuncture points. So while using the needle, we use usually the filiform needle. The image shows the filiform needle. Certain points has to be penetrated in certain positions. Okay, that is called as position of the needle, which says that certain points cannot be inserted 90 degrees. Certain points has to be inserted around slanting position, which means the around 45 degree. And then certain points has to be in a horizontal position. The pricking has to be done in a horizontal way, oblique way, or in a perpendicular way. So every point should not be posed in the perpendicular or in a right angle way. The angle of the needling will be changed depend upon the point which one we select, the underlying organs and all those things. The selection of the point position will be, needling position will differ depending upon the points you select. So next is the moxibustion, the using heat to stimulate. Moxibustion is nothing but we use in acupuncture, we use moxa, which is a leaf that is called as Artemisia vulgaris. Artemisia vulgaris is a herb, you can say. So this herb will be grinded and made into a coarse powder and a fine powders. The fine powders will be made in a cones, and the coarse powders as a cigar kind of things. So these cones and cigars, we can use it for stimulating the acupuncture points, where the heat will be felt by the patient. So the heat should not be extreme. Burns has to be avoided in this practice. So only an expert who are very well practiced in acupuncture can give this moxibustion. Next is the cupping therapy. Cupping is nothing but stimulating the acupuncture points where the ashi points are selected, or it is very, very useful in the musculoskeletal disorders, you can say. There are two types of cupping. One is dry cupping, another is wet cupping. The first image you see is the dry cupping, the glass one is called as dry cupping. The second is the wet cupping. So where the blood will be sucked from the area. So this is said to be the what do you say, the clearing the chi, stagnation of the chi and the stagnation of the blood in the particular area will be removed by the cupping. Actually, this is the successful techniques in naturopathy treatments, we can say. And after cupping, the skin condition will be like this. So, but this is common in cupping. So this discoloration will be healed by the body's own immune system itself. It will take around 4 to 5 days to come back to its normal, what do you say, the normal color of the skin. At the maximum, it takes around 7 days, not more than that. So it's not a complication, but this is the treatment post will be, this will be the condition of the cupping. The skin will be like this only, which is normal. There's nothing to worry about it. If there is a chances of infection or any inflammation or a boils in it, so that has to be treated accordingly by the treating physician. That is the complications of cupping, but usually complications are very rare. And so the special thing is like a selection of the acupuncture points, where there are a lot of acupuncture points are there, more than 500, 600 points, acupuncture points are there. So among that, they have segregated the acupuncture points in a groups. Like, there is something called as a distal point, influential point. Distal point is nothing but the proximal body parts points will be given in the distal areas, like forearm and in the hands and in the feet the point will be present, but it represents the proximal area. For example, for a headache we can give point in the hand, so that is called as a distal points. So something like that, there is something called as influential point, which is has an influence on some particular body organs, like influential point for bones, influential point for muscles and tendons, influential point for blood, solid organs, something like that is there. There are points are there, so we can select according to the symptom. That point can be given as a needling or a stimulation. There is something called a C cleft point, which is advised in the acute conditions, dysmenorrhea, headache, and all those conditions. Leo connecting point, when the yin and yang is deficient, imbalance, we can select those points. There's something called as yuan source points, alarm points, back shoe points, front new points, tonification points, sedation points, horary points, and jingle points, or many like this. There are point selection options are there in acupuncture, which can be selected according to the symptoms of the patient and the pulse also. So next is the what do you say, the ear acupuncture. It's also called as auriculotherapy. So we have a meridians in our body which flows throughout the body, but this ear acupuncture is something the whole body is selected in the ear itself. You can see the second image. So our body position is something like this in an inverted baby posture. All our organs, as foot, brain, abdominal organs, everything is reflexed, or everything's reflex system is present in the ear itself. So by stimulating only the ear, we can give a reflex action in our internal body parts. So this is the type of ear stimulation or ear needling, which is the first image. It is the filiform needle is used for stimulating the acupuncture points, and then second is the press needle, second image. So this press needle is unique, which can be placed what do you say, for a longer duration, around more than 3-4 days we can keep this needle. It is a kind of a pasting method. So for a long and prolonged stimulation of the particular points, this press needle is used. And in acupuncture, there is something called as reflexology. This is also same like auriculotherapy. The whole body is reflected in the right and left foot. And which you can see in the image, you can see the stomach region, kidney, spine, bladders, intestine. The left side, it will be the heart, right side, the liver points will be there. So on stimulating this foot, both the right and left foot, the reflex action will be present in the internal organ. This is also a basic technique in acupuncture. There is something called as the zone therapy, where the body is divided into the 5 zones, right side 5 and the left side 5 zones, it is divided. And then accordingly, from above to down, the treatments will be given, or the needling and the friction will be given for the stimulation of the particular area. And we do have a reflexology of the palms. Palm reflexology is also there, and then foot reflexology is also there. More or less, palm and foot reflexology is something, same concept is there, where the whole body is reflected in the palms, the right palm and the left palms. So you can see the images here. So coming to so these are the treatments which is present in the traditional Chinese medicine we practice in acupuncture. So these are the effects of acupuncture in different diseases. Scientifically, when you see, this is something very well proved acupuncture results. The first and foremost result is the midbrain, which is containing the medial reticular formation, which it contains the, what do you say, the pain reacting cells. Okay, so this midbrain has a major role in producing the acupuncture analgesia, which is like a pain reducing quality. Midbrain has a major role, especially the reticular formations. Okay, medial reticular formations. So next, there is an inhibitory interactions in the thalamus, the afferent and the efferent nerves. No, so there is an inhibitory interaction in the thalamus between the incoming afferent and the efferent one from the points of acupuncture and from the site of the pain. And there is an improved microcirculation is there, because due to the needling, there is a vasodilatation of the capillaries, and arterioles are there. And there is also a pain relieving is happening. The analgesic effect is due to the release of opioids, serotonin, cyclic AMP, ACTH, cortisol, catecholamines, and all those things. And there is a stimulation of large fiber nerves is also getting stimulated in acupuncture. And then acupuncture also releases the spasm of the muscles by improving the microcirculations, so that the spasm is relieved and the spastic pain is also getting relieved. And it also reduces the blood pressure by inducing generalized vasodilatations. And it is very good for dysmenorrhea, as it is inhibiting the release of prostaglandin. So this prostaglandin is something which is responsible for the contraction of the uterine muscles, which induces the periods pain. So in acupuncture, this release of prostaglandin is restricted, or it is inhibited, the what is synaptic areas it is happening. And then it is, acupuncture is very, very good in depression and anxiety disorders, as there is a release of serotonin, which is also induction for the sleep. Next is the acupuncture induces the defense mechanism in our body, which is like it improves the immunity due to the B cell stimulation, and the GABA globulin production is also there. And then there is a stimulation of endorphin and encephalin release is there, which is which feel good hormones are secreted. And then here stimulation of the serotonin release and increased circulation of the serotonin is also there, which gives the good feel also there. Next is like acupuncture gives nice result in the visceral function improvement. If the function is less, the improvement of the visceral function will be nice due to the what is it, the circulation improvement. That's it. Okay. Important thing is like sedation. Sedation is like a after acupuncture, there is a production of serotonin and the increase of serotonin in the circulation is there. This serotonin, no, it increases the production of melatonin, which induces the slow wave sleep by its action on the reticular formation, limbic cells, and the suppression of this spinal pain transmission. So all those things are happening by the single needling only. So on together, when you see relaxation and the induction of sleep is happening due to the release of serotonin and the melatonin by the acupuncture treatments. So when giving the acupuncture treatments, what are the complications we may expect? So actually, complications are rare, but even though there is a complication, it can be handled very smoothly by a skillful acupuncturist, we can say. The first and foremost will be the pain. Usually, as the needle is very, very thin, so the pain level is actually milder only. But if the acupuncture is not skilled, or if the patient pain threshold is high, then the patient may feel pain on that area. So only a skilled acupuncture know how to reduce the pain in the acupuncture session. Next is a fainting. The patient may become unconscious and the needle may stuck. It has a strong reason for that, and only a trained acupuncturist can remove the stuck needles also. And then there is a chances of needle bending, needle breaking. If the quality of the needle is not good, then the needle breaking can be happen. And then because of the needling, the skin may show some local reactions like reddishness or black discolorations also. This is also a complications. And there are chances of the underlying tissue injuries, maybe organic injury like the cartilages, the bone can be damaged if the penetration is too strong. Okay. And then there is a chances for infection post after the acupuncture area, because during puncturing there is a hole is there. So if that hole is not treated properly, then there are chances of infection is there. So only an experienced acupuncture can prevent all these complications and can handle all these complications very in a smooth way without giving any anxiety to the patient. Next is like these are the conditions. Few conditions have written like not to give acupuncture. It is not supposed to give on any injured area. The skin is not healthy, then that area we are not supposed to give. And then hyperplasia is nothing but the tumor or the cancer, we can say. So we are in what do you say, the chances of spreading of this cell is chances are there. So that is why it is contraindicated. And in pregnancy, better to avoid in the first and third trimester. And then any hemorrhagic disorder, if the patient is having, then it is not advisable. If the patient is alcoholic, then the acupuncture is not advisable and the acupuncture will not be effective also. And then after a heavy meal, acupuncture is not advisable. Even the patient is feeling very hungry or very much thirsty, even after that also this acupuncture cannot be given. Very, very old to young patient also this acupuncture cannot be given or should not be given. So that's about the acupuncture treatment modalities, what we practice in JSS INYS. Thank you.
Thank you so much, Dr. Sapna ma'am, for an insightful and enriching session. I also extend my heartfelt thanks to our principal and the management for giving us this wonderful opportunity to host today's webinar. To all the viewers, thank you for your active participation. Please stay. Thank you.